I'm trying to increase hamstring flexibility, I'm going to raise his leg in this position. Okay? So now the hamstring is crossed over two joints. Now, if I want to just pull out the hamstring and really not get too far involved with the gastroc and things like that, I could go ahead and flex him to 90 here, hold him here, and then now extend up. Okay, so this would be different manual techniques for manual stretching. So we can ask you this. But if we're doing this whole P and F, agonist, antagonist, contract, relax, okay? So he comes up, or I bring him up passively. He comes to here. He can't go any further. The range limiting muscle is what? It's hamstrings. The hamstring is termed an antagonist, okay? So if I say push into my shoulder, 1, 2, 3, 4, 5, 6, relax. As he relaxes, wait another 5 seconds or so, then I'm going to bring him up. Okay, now on your midterm, if you're doing this and Dr. King says, okay, show me something else, show me a different way to do it, show me a way to stabilize. Now it may trigger, oh, okay, well, so do you mean hold this leg down? Do you mean I got to put my leg up and put it over here? Yeah, so know the variations and how to block the other leg, okay? He pushes down, I bring him up higher, and now I got more range. I let him hold for about 20 to 30 seconds. Pushes down again, 1, 2, 3, 4, 5, let him relax, I hold him, bring him up, and take him again, okay? So I like to look at that as that specific, he's contracting isometrically against me, okay? Now, some people are going to term it hold, relax. So he's holding, go ahead, or I'm holding him, and now he relaxes, I take him more. The words hold, relax, contract, relax are somewhat used interchangeably. The way you can remember the difference, if you want to, is contract, relax would be he's going to contract through the full range of motion. So if he's at 0 and he goes to 70, so he's going to contract from 70 back down to 0. So now he goes push down. I'm going to let him push down. Go ahead. I'm going to let him come all the way down. Now the theory is his muscle that he just contracted is going to fatigue and relax, and then I'm going to bring him up. Passively, I'm going to bring him up. The contract, relax, agonist contract. Okay, so now his quad muscle is the agonist. So again, he pushes against me, pushes all the way down, go, go, go. His hamstring is firing, he's firing. And now, while this muscle is now relaxing, his hamstring, he's going to lift his leg up. His quad is excitatory. You guys following? When you're going against gravity, two muscles both can't be excitatory at the same time. So his quad is excitatory. That makes his hamstring inhibitory. And so he's actively bringing his leg up to stretch his own hamstring. So I don't want you guys to look at it as, well, he's bringing his leg up, so he's stretching his hip flexors. His hip flexor muscle is allowing his agonistic muscle to work, but that's not the purpose of the stretch. You guys understand? So if I were to say now show me how you would strengthen your hip flexors, now he doesn't. So he can either do hip knee flexion. This is hip flexor. He can go up like this. The rectus, that's the hip flexor. So either way, I've asked him to show me something for two different reasons, but it's the same movement. So this is where you guys really have to know your stuff in that way. Okay, so you guys follow that? On your stomach. Can you give me a towel, please? So if I'm going to try and look at his right leg, I'm going to put this towel where? Above his knee. Okay, good. So say, for example, he can only go to maybe 100 degrees or 105 degrees of knee flexion. So I can passively bring him right to here. He actively tries to go more. Maybe he stops. That's as far as he can go. So what's the range limiting muscle? You can think of it more globally. You can just say quads. Okay. Okay. So his hip is in neutral. So let's just say I'm trying to tease out just the quadricep group. And again, when you have the quadricep group, you have 4 muscles for the quads. What are they? Fascius. Exactly. So you got the 4 muscles. So it's hard to really, when you strengthen, it's hard to just strengthen one of those. They all come together. So when you have a limitation, usually to some extent they're all working together. But in this case, I have a position where I'm just looking at the quite tight quads. So now, if I do a contract, if I do a hold relax, what am I going to have him do?
Push against you, you're going to hold it.
He's going to push against me. Okay, so he's here. Go ahead, push down, relax. Okay, push, and back up. Okay, so now he relaxes. I take him a little further. Okay, so now push again. So he pushes. Now, so if a patient were to do that, okay, so now he's calling in other muscles to do that. So then my job would be to say, don't lift your hip up, just straighten your knee out, go. So the objective is just to fire the muscle that I need him to. Now he relaxes, then I take him back here. Contract, relax would be as he's here, and go ahead and push down. So now he pushes the whole range. I let him relax, then I passively bring him back. Okay, you guys see what I'm doing? So he pushes against me. Go ahead and push. I give him resistance. He relaxes. I passively bring him back, take him further. The contract, relax, agonist contract, because what muscle says agonist? Hamstrings. So he pushes against me, go. Quads are firing. And now he's stopped. Now his quads relaxed. He's going to use his own muscle to pull back and stretch. Okay? So that's looking at the quads, looking at the hamstrings. Same principle applies to the bicep and tricep. Do you guys want to see that, or are you okay with that? Okay, turn on your back shot.
Which hip would you stabilize? The contralateral when he's prone?
For that one, it depends on how much he's lifting up. But I can stabilize easier, but typically I like to stabilize the ipsilateral. I don't want movement coming from the side that I'm stretching. So if he's coming up here, for example, and he's moving on this side, I'm still able to stretch here, but if he's moving all through on this side, I'm gonna try and stabilize right here as he's coming up, because this hamstring is going to be attaching to that ischial tuberosity area, so I want to hold that fixed as I'm bringing him up.
Same with prone.
Yeah. For the bicep, if he had limitations in flexing, so he can't flex, and you're doing a stretching motion, don't get caught in the trap of saying, I need to strengthen the bicep muscles. So why wouldn't that be appropriate? Okay, so here's the key. So Normal elbow flexion is 100 and what? 108?
35.
135, yes, more than 108. Yeah. So he should be able to bend his elbow 135 degrees or so. If he does it on his own, against gravity, functionally, he has to contract his bicep. If he had some kind of injury or surgery and he was immobilized in a certain position for a period of 4 weeks, whatever it is, then you remove the immobilization, and now you want to start going through a range, and he's tight, he's limited, okay? If he's limited due to a muscular restriction or a joint restriction, strengthening the muscle that controls the movement is not gonna improve necessarily his ability to get in full range. Okay, so how can you test this? One, you could do a manual muscle test. So say he only has from 0, he has from 0 to, let's say, 100. So I can test him, manual resistance, go ahead. So he's able to have pretty good strength through that range. So I know it's not a muscular deficit. I have to say, what's the other reason why he can't bend? The triceps are tight, and it's now allowing me, okay? So as the biceps shortening, the other muscle is elongating, okay? So here we are. And so what I might do is he's gonna push into me, okay? So if he pushes into me, he's activating that muscle, and then he relaxes, and I take him further. If I want to do the contract relax, so then he's gonna push all the way down, fires his tricep, and then he relaxes. I'm gonna see if I can take him to 120, get him more. And then if I want to do the agonist, okay, so he pushes in, and he goes all the way down. I take my hand away, curl up, and he uses his own muscle, and he might get to 125.
So talk Dr. Tino through the opposite. He can't extend his elbow completely. What would he do?
Come and show us, Regina.
Okay, and contract. So what compensatory, these are my kind of questions, what kind of compensatory motions are you going to look for to see if he's cheating? Or if you're...
If the shoulders.
Right. Right, you just have to know the origin and insertion, right? That's what you want to watch for, is that compensatory motion.
Very good. Perfect, guys. So that's pretty much how we as clinicians are going to be doing the contract, relax, and the P&F mediated type of stretching is those gross muscles. Hamstring, quad, elbow flexors, extensors, sometimes shoulder internal, external rotators. When we get to the shoulder lecture in lab, we'll go more specifically through the scapular work with the scapular mobilizations and the rotators. But right now, I want you guys just to know the bicep, tricep, hamstring, quad. Okay? Okay, very good. So you guys can kind of start practicing, and when I unless you want to just say, okay, guys, watch this is how we're doing it, how we're stretch the arm, go through your tempo. Or you can go around and sort of like, you know.
Well, I can maybe do both. I wanted to kind of maybe field some questions first, that I can kind of hear what questions you have for me. No.
She's all yours. User, abuser.
I should have worn like body armor today.
No, don't I'll ask you questions.
Yeah, I don't care.
Okay, if you guys want to record what she's saying, you can. That's your privilege, and while you're away.
Yeah, and by the way, I didn't get the stuff from the other day on. I can't get into my companion, but I brought it with me. So today you'll be able to have your information for your. Yes, I rewrote the objectives. Thank you, Brennan, for pointing that out. I redid all of those. I have my template, and I have the rubric that I will give to them to look. I just couldn't get into it. So I didn't forget. I just couldn't get it. So I am a real taskmaster when working with patients, and therefore I'm like that in working with you guys. So because it's important that when we're working with patients, we can articulate what we want them to do clearly in layman's terms. So I really am going to discourage you from saying lie supine, externally rotate your hip. That's not going to be what they understand. So I want you, when you're practicing, to practice like you're working with the patient. And when you're the patient, be the patient. If you're supposed to be prone and they tell you to get supine, although you know it's wrong. That way they can figure out, oh, no, that's not what I meant. This is the time that you make those kind of, you're working with the patient sometimes, and you may say it wrong and say, oh, no, I meant the other supine, to just, so you just kind of wing that when you're working with patients. But in your practice that you're really a patient, do what the clinician asks you to do. The other thing is when you're working with patients and each other, watch for those compensatory motions. You want to make sure that what you're doing makes a difference. You can spend an hour working with the patient, and you might miss the big picture and make it a completely ineffective treatment. So it's first do no harm, but we also want to be effective in what we're doing and how we're educating. And I like to see the thought process. I want to have you think out loud. And I am not black and white. I have a lot of gray area except for in the areas of patient safety. So if you might do something that is not in your textbook, that we did not review here, but you can explain to me the rationale as to why you did that way, I have no problem with that. Maybe you just came up with a new technique of doing something. That's the way, ingenuity, that's where it arises. So I'm okay with that. So if it's a different position than what we practiced, if I throw a scenario, let's say you can't get the person in supine, let's say you can't do this, I need you to be able to kind of think out of the box. The biggest problem with this particular group in here is not that you don't know it, because you guys know it and you get it, is that you overthink it. When you step into my practical, you overthink it. Give me some basic exercises. You're trying to think real complicated. Give me ankle pumps, quad sets, and glute sets. Work on shoulder rotation. Okay, what shoulder rotation? Don't start thinking, okay, what position? Just saying, okay, what do I need to do? Okay, I want to have them do this. What position do I want to get them in? So just drop it down to the basics and don't read more into it than what's there. I mean, that's my best advice for you, is not to overthink it, evaluate what you want to do, and if you get stuck, drop back and say, I need a second, and figure it out, kind of do it on yourself. Okay, let's be doing abduction. This is going to go inferiorly. How do I want them positioned? I can do them this way. I can have them on the... So think about it on yourself first. That 30 seconds is well worth it, trying to problem solve that to come up. My challenge is that I try to figure out who wants me to say, think about another position, and who wants me to just keep my lips closed. So I don't want to mislead you, but if I see you starting to spend time go astray, I want to redirect you, and I want to do that gently without throwing you off or causing you to, get real nervous or thinking you were doing something really awful. So that's my challenge. So when you come into my station, you can tell me if you want to. Don't tell me anything. Just let me do my own thing. I'll figure it out. If I bomb, I bomb. If I do it all wrong, that's okay. It just makes me nervous when you talk to me. I'll still ask you questions, because I still will ask you two critical questions having to do with what you're doing. But if you'd rather me not guide you back. For example, several people started working on the wrong extremity, and I would say, read the card again. What are you supposed to be working on? If you don't want me to say that, and you want to continue on the wrong extremity and get marked off, I will do that. But I want you to tell me that walking in, so I can write no cueing. So I don't want you later to say, well, she let me go all the way down this path. But I'm happy to not get in your way. But if you come in and you don't tell me anything, then I will kind of gently try to guide you back. But I watch you guys for expression. And if I see you starting to get nervous, I'll either tell you to take a deep breath, or I'll just quiet myself. Okay? And when you're practicing, practice in that, we're not going to be timed in here, but practice in a timed environment. If you do it in a timed environment and you put yourself under that kind of pressure when you come in here, it's like, okay, let me just see what you can do. It'll be much easier. Practice, practice, practice. It's the best way. Same thing with what you're going to be doing in your ortho pairs. That rehearsal is it'll be a piece of cake if you just rehearse it. Now, obviously, you can't do every possible scenario. You're not going to know every question that we're going to ask. But if you have the basic anatomy, origins, insertions, hand placement, know how they can compensate, you'll do fine. You guys are a really, really smart group. You are. You have the basics down. Not only that, you have good clinical skills. You have good communication skills. You just get caught up in here. Okay? So, any specific questions for me?
What things do you find that you do most different than the other professors?
I don't know how all the other professors do things. I think that Dr. Tino and I, although we do some things differently, like how we hold, our biggest difference is the body size, male, female, and strength. He is strong and can hold things. So I usually climb up on a table and get on top of a person's leg, or I hold onto their arm. I use my body weight and things. You know, you guys that can do it the way he does it, God bless you for that. And the ladies, if you have a big guy you're working with, I might say to you, you know, let's say this person was 300 pounds. You're working with an athlete here. How would you stretch his hamstrings? What are you going to watch for? I might ask you a question like that because that's going to be real life. And I don't want you to be in a scenario where you're trying to figure out, you know, exactly what to do on the spot. That's probably the biggest difference is how we use our body to do things. When I do shoulders, what we'll get to next week, I kind of cradle them more. And again, he's bigger and can make a person feel more secure. I like to cradle them so they feel like, you know, I'm not going to drop them. It's just some of their manual skills are different. I think terminology is the same. Most of that's, unless you guys have you noticed something specifically that we do, other than that we do differently? And our documentation, I know between all of us, we all know exactly where things go, and we will spend, we really need to spend more time on documentation, we'll do that, and that's one of my big areas of emphasis in all types of training and audits. You know, just it's necessary for you guys to be able to do that well. Unlike when the group here was in school, it wasn't as important. We could do tolerate it all well and progress with planet care. You can't do that anymore. So there's just a lot of changes. Any other specific questions? Those are good ones. Anything specific? Yes. Yes. Are we going to do that together today with Dr. Tino? I think we're going to have that on the.
We did that already.
We did.
We
did that this morning.
Because each teacher is different. If there's subnotes, how are you looking for anything specifically wording-wise?
I encourage you. Do you want to break up and do some labs so I can watch you do some of those things, or do you want to go over some useful catchphrases that I'm not suggesting you use, but you might find them helpful? If we have time to do both, we can do
Lab practice.
Yes.
If we're working on our own, if you could maybe like write them on the board, like the catchphrases, and then we can copy them down. I don't want to waste time doing that when we should be practicing everything else.
Okay, but I want to be able to, when you're practicing, I want to be able to spend time. Let's do that. Let's get your comfort level with your hands-on skills down. Whatever time we have left, we can always do that later.
Yeah.
Okay, but it's going to be better if you guys participate in it. But let's do this. I
Let's make sure we get physical hands-on time.
Okay. Grab your partners, get to your stations, and I'll come through. I'll be asking you some questions just to see how you do them and see what kind of practice.
There you go.
I had a good talk. I love it. Ready for your work here? How'd you do with your other one? Okay. No problem. See you next semester.